Here we'll talk about National Urban Health Mission. So before that, National Health Mission is divided into National Urban Health Mission and the Rural Health Mission. So National Rural Health Mission is for the cities and towns where the population is less than 50,000. And for the states and districts where the population is above 50,000, we'll implement this National Urban Health Mission. Mainly focuses on urban poor population or urban slums, homeless people, rag pickers, street children, rickshaw pullers, brick and construction workers and the sex workers. So basically urban slums. It mainly focuses on urban slums and also homeless, street people, rickshaw pullers and all. And it focuses on strengthening the public health capacity by improving clean drinking water, vector control and sanitization. So by National Urban Health Mission, what are they trying to do? First, they are focusing on this urban slums, and then they are providing this clean drinking water, vector control and sanitization for this urban slums, right? So that is what they are focusing on. So let us see the targets of National Urban Health Mission. 40, 50, 100, right? So there should be 40% reduction in the under 5 mortality rate and the infant mortality rate. It is related to children, right? So 40% reduction in child death rate. Coming to 50%, 50% reduction in the maternal mortality rate. And how will you reduce this infant mortality rate and the maternal mortality rate? By providing institutional delivery. So there should be 100% institutional deliveries. And also TFR should be 2.1. And universal immunization should be done in all urban areas. See, in the National Urban Health Mission, the main focus is on the urban slums, right? So we are providing them clean drinking water, vector control, sanitization, and also we are trying to provide universal immunization. So it is one of our targets, right? And all the targets of disease control program should be achieved. So what are we trying to do under this targets? One is 40%, next is 50%, next is 100%, 2.1. So under the 40%, there should be reduction of infant mortality rates and the under 5 mortality rates. Under the 50%, there should be reduction in maternal mortality rate. And the 100% should be institutional deliveries and 2.1 TFR. And apart from all of this, you're also providing this universal immunization for all the urban areas and also targets of disease control programs being achieved. Now let us see the services provided at the different levels. So for the population of 500, we have Mahila Arogya Samiti. So what does she do? She participates in this preventive and the promotive health activities along with the Anganwadi workers and the Ashas. So at the population of 500, we have Mahila Arogya Samiti who participates in preventive and the promotive health activities along with the Ashas and Anganwadi workers. So at the level of 2500 population, we have Asha who will be taking care of 200 to 500 homes. So she will be supervising this DOTS program and also RCH. She'll escort the people to the PHCs and Anganwadis and she'll maintain the records. Education and counseling is also provided by this Asha. At the level of 10,000 population, you have one auxiliary nurse midwife, right? And she will do this outreach sessions. Now let us see what are the services provided by this auxiliary nurse midwife, Asha and the Mahila Arogya Samiti. So under the maternal health, they'll register the pregnancies, they'll check for any danger signs, and also they'll provide antenatal checkups, postnatal checkups and all. And under the family welfare program, they'll try to distribute these condoms, OCPs, and they'll educate these people on this contraceptive methods, right? So under the nutritional deficiency disorders, they'll check the height and weight. So they'll do this basic examination like they'll check the height and weight, hemoglobin, iron folic acid supplementation is being provided, iodine salt supplementations are being provided by them, right? So under the nutritional deficiency, they'll check the height and weight, hemoglobin, and they'll also provide this iodinized salt. Now coming to this vector-borne diseases. So for this vector-borne diseases, they'll control this thick and thin smears. They'll also spray this DDTs and rapid diagnostic kits also. And they'll do the diagnosis by this rapid diagnostic test and they'll educate the people, right? So for the TB, they'll participate as this DOTS agent and also they'll do the symptomatic search in the community. And for any cardiovascular diseases, they'll try to check the BP. They'll also find this symptomatic search in the community. And for the diabetic mellitus, again, they'll do this basic examination like urine examination, blood sugar and all. And along with that, they'll also do the symptomatic search in the community. And the last thing is, if they find any complicated case, they'll refer it to the UPHC and UCHC. So that is Urban Primary Health Center and Urban Community Health Center. So let us see about this Urban Primary Health Center. It is maintained at the level of 50,000 population. So it is also maintained near to the slums. So we have PHCs near to the urban slums, right? So it consists of one OPD. Only outpatient services are given, no inpatient services. Inpatient services are only given in community health center. And also they'll have this basic laboratory diagnosis, drug and OCP distribution. And also they'll counsel about this non-communicable and the communicable diseases. Now let us see the services provided by this PHCs. So under this maternal health, again they'll provide this antenatal checkups, postnatal checkups, they'll do this normal delivery, and also they'll manage the case of regular maternal health conditions. Not the complicated one, because the complicated cases are referred to CHCs, right? They'll just manage this regular maternal health conditions, but the complicated cases are being referred to CHCs. And under the family welfare, again they'll distribute the condoms, OCPs. They'll also provide these IUCDs, right? So they'll insert IUCDs and refer the sterilization cases for the CHCs again, right? And all the diseases like nutritional deficiency diseases, vector-borne diseases, TB, CVS diseases, diabetic mellitus, reproductive tract infections, all these diseases, if they are simple cases, they are diagnosing here and also they are treating the cases. But if there is any complicated case, we are referring to CHCs again. Now coming to the urban community health centers, it is maintained at the level of 2.5 lakh population. So here we'll also have this inpatient services. That means patient can be admitted here and 30 to 50 beds are being provided. And also for the metro cities, we have 5 lakh population. So for the 5 lakh population in the metro cities, you have one CHC and there you have 100 beds, right? So for the non-metro cities, you have like 2.5 lakh population with the 50 beds. So under one CHC, you have 4 to 5 PHCs, right? So now let us see the services provided by this CHC. Under the maternal health, again they'll conduct these deliveries, they'll manage this complicated case, because all of these people are sending this complicated case to CHCs, right? So they'll conduct this management of complicated cases, surgeries, blood transfusions. All these complicated things are done at CHCs. And under the family planning services, they'll do the sterilization, because at this level they are distributing condoms and OCPs. At this level they are providing IUCDs. But at this level we are doing this sterilization process, right? And the next diseases like reproductive tract infections, nutrition deficiency diseases, malaria, TB, diabetes mellitus, cardiovascular diseases. For all these cases, management of complicated cases is done here. See, at this level we'll have outreach sessions, right? So here for the population of 500 you have Mahila Arogya Samiti, for 2.5k you have Asha, and for 10k you have auxiliary nurse midwife, and they'll all provide this outreach services. That means they only go and provide all the services, right? So Asha does this DOTS agent RCH program. They'll escort the people to the primary health center, Anganwadis and all. They'll keep the records, education, counseling and all. So here she'll do this health activities along with Anganwadis and the Ashas. Now at the level of PHC, it is placed near to the urban slums, so it is at the level of 50,000 population. So for the 50,000 population, you have one PHC which is near to the urban slums, right? Again, you have this OPD services but no inpatient services. You'll have basic laboratory services, drug and OCDs distribution, and also counseling about this diseases, non-communicable and the communicable diseases. So the things you have to remember is OPD counseling and basic laboratory services are being provided, and also drugs distribution is being provided, right? So at the level of CHC, it is for 2.5 lakh population, and for the metro cities, it is at the level of 5 lakh population. So for the 2.5 lakh population, you will be having 50 beds, and for the 5 lakh population, you will be having 100 beds, right? So under one CHC, you will be having 4 to 5 PHCs. So here you'll also have inpatient services. Here outpatient services, here inpatient services. Now if we see the services at this outreach level, so basically we are talking about maternal health, family planning, nutritional deficiency diseases, vector-borne diseases, TB, CVS and diabetes mellitus. So they'll do this basic examinations like urine and blood sample collection and BP, basic checkup and BP measurements, DOTS agent. They'll do this rapid diagnostic test, they'll provide or spray this DDT, they'll conduct this thick and thin smears, education and all, right? And also for the nutrition, they'll conduct this height and weight measurement, hemoglobin estimation and all. So they'll supplement this iodinized salt, iron and folic acids, etc. They'll also distribute this OCPs, condoms and all. So what are they doing? They're outreaching to the patients and giving it. So they are going and conducting these examinations like BP, height, weight checkup. They are going and distributing these OCPs, condoms and all, right? And if there is any complicated case, they'll refer to the PHCs. So what do you do in the PHCs? They'll diagnose and treat normal cases. They'll diagnose and treat the simple cases. If there is any complicated case, they'll refer it to the CHCs, right? So here also they'll conducting this normal delivery, management of normal cases and all, distribution of this, and apart from this, they are also inserting this IUCDs, right? See, at the level of CHCs, you have sterilization. At the level of PSCs, you have IUCDs. At the level of ASHA and all, they are distributing condoms and all. And in case of CHCs, in the maternal health, family health and all the diseases also, they are managing the complicated cases.